So the important distinction includes the overall approach to the pediatric patients, because we don't just include the patient, but we include the family members of the patients. The spectrum of diseases for children is way different from adults. Adults focus on a lot of cancer monitoring, and as such, they do a lot of procedures, whilst with pediatrics, we see a lot of congenital problems. We do more of history taking and physical exam. We make sure to adapt the diagnostic testing that we do and the therapeutics to the pediatric age group, because we need to consider how we give it, the side effect profiles, and the long-term implications of the treatments that we give. Remember that children are not small adults. However, there is a number of diseases that cross over to the adult side, such as your inflammatory bowel disease and your hepatitis B, which is why there's a need for a good transition program from adolescence to adulthood. Tummy aches is always at the top of the list. So that can be from reflux, it can be from colic pains. In young kids, constipation is very common. We also see jaundice, especially in newborn babies. Feeding difficulties, picky eaters, always at the top of the list as well. Since the pandemic, we've seen obesity. During the pandemic and after the pandemic, we've seen a lot of obese children. And inflammatory bowel disease has also been increasing in incidence. So we see a lot of those too. With tummy aches, a lot of kids have tummy aches. So do the tummy aches come before and after meals? Is there vomiting? Because that would signal the possibility of reflux. Are they burped often? Do they pass out gas? Are they relieved? And that's your colic. Feeling of fullness and relief after defecation or after pooing, then that could be constipation, no? in some instances. Now, jaundice, or the yellow color of the child, is not normal beyond a month of age. So in newborn babies, jaundice should go away by 1 month. If it's not, then you have to investigate, because you want to make sure that there is no biliary pathology. Feeding difficulties also, there's a lot of that. Parents are very concerned that their child's not gaining weight. So is the child gaining weight? And we also look into the family dynamics on feeding, who feeds the child, how they feed the child, where they feed the child, and how long is the child fed for. On the other end of the spectrum, obesity is also a common concern. We check on the lifestyle and the diet of the child, what he usually eats. We ask for a food diary, for 24-hour food diary of what he eats, so we can see the calories that he takes. Inflammatory bowel disease, quite common now. We see a number of those in clinics now. They usually present with tummy aches, bloody stools, failure to gain weight. It's inflammation of your gut that can happen anywhere from your mouth to your anus. We need endoscopy to diagnose that, because we need to see the extent of mucosal involvement. And with this one, we need to make sure there's no cure. So we need to make sure to keep it at bay, so they have maintenance medicines throughout their lives. Diet is very important in ensuring the growth of a child. A number of disorders can actually be prevented with a proper diet. So for babies, you advocate breastfeeding and starting complementary feeding at the appropriate time, which is 4 to 6 months. For growing children, then you need to make sure that they have a diverse diet. So 4 out of the 7 food groups, they're given 5 servings of fruit in a day. They get 3 structured meals in a day. Minimize screen time to less than 2 hours, and make sure that they get an hour of moderate to vigorous exercise every day. Try to avoid sugar-sweetened beverage as well. So with regard to diet, choosing home-cooked meals over fast food is always a good idea, especially in children with GI issues. Probiotics are classified as GRAS, meaning they are generally regarded as safe, but not all probiotics are created the same. Probiotics are very strain-specific and very dose-specific. So, most commonly studied probiotics would be your lactobacillus and your bifidobacteria. So, I give probiotics, but I would go back to the studies. I would depend on the indication for giving your probiotics. I would always tell my co-physicians and my patients to look at the evidence. So go back on the studies on the efficacy of the probiotic for that specific disease. It's safe to give in the very young because they said newborn babies don't have not developed their own gut flora, so you may help it grow. But then again, you always look at the evidence. What are you giving it for? What are the effective strains of your probiotics?